Hello, my name is Lucia Medina. I'm a nurse practitioner student, and I'm doing this video for the class of Advanced Health Assessment in U650. And we're doing the video on the assessment of the head, eyes, ears, nose, throat, and neck. This is my daughter, Jimena Vasquez, and I'm her legal guardian, and I'm gonna ask her if she give us permission to record this video.
Yes.
And I also give permission to record myself. Before we start, I'm gonna say that it's always important to have a room that has a good lighting. It's warm for the patient. We need to explain everything that we're doing so we can make our patients trust on us. And also, very important to wash our hands before we touch our patients. I'm gonna start with the inspection of the head and face. The head, we need to see like the shape of it, to see the contour, to see if there's any deformities, any depressions, any masses, any protrusions. Then the face, we're gonna look at the skin color. We're gonna look at the skin color, the symmetry, the facial expressions, any areas of swollen. And then we're gonna go to the eyes. The eyes, I'm gonna note like the eyebrow alignment. I'm gonna look at the eyelid to see if there's any swollen. I'm gonna look at the sclera that is supposed to be white, the conjunctiva that is supposed to be pink, the lacrimal duct to see if there's any abnormal discharges. I'm gonna look at the iris, the pupil, the cornea, and look for any opacities when we're putting the light on the eye. For the pupil, it's important to see like the size. It has to be between 3 and 5 millimeters. The color, the shape, the symmetry, and how it reacts to light and accommodation that we'll do in a minute. Before we do that, we're gonna see the visual acuity of the patient, and I have a Snell chart on my wall. And we're gonna ask the patient to stand up, and if they have any corrective lenses, now take them off. And we're gonna ask the patient to cover one eye with one hand and read the line that it's the smallest line that they can see.
D E F P O T E C.
Okay, and we're gonna do the same with the other eye. Go ahead and stand up. And then the results of the Snell chart, it's usually 20/20. That's normal, that you can see an object at 20 feet. And if you have a result that it's 40/20, that means that you can see an object at that at 20 feet that other people with normal vision can see it at 40 feet. After that, we're gonna do the light direct reflect. Ask the patient to take out the glasses, and then we're gonna put the light on the eye of the patient, starting from a side, to see like the cornea. Says the cornea, look for any opacities like in glaucoma. When you put the light direct into the pupil, if the pupil constricts, that is like a positive reflect of the pupil. And when you do the same process, the consensual reflect is that the other pupil is going to constrict too. And then accommodation. How the pupil reacts to accommodation is how the pupil focuses in a distant object and a near object. So you're going to ask the patient to look at the pen light, and it's going to start to move in towards the patient and see how the pupil constricts, that it's normal. that it's reflect to accommodation. After that, we're gonna test the visual fields of the patient by confrontation. And what you're gonna do is you're gonna divide the eye in 4 quadrants. And either you can wiggle your fingers and you can ask the patient when they see them, or you can show fingers and ask the patient how many fingers they are seeing. You're gonna ask her in this case to cover one eye. And so you're gonna ask the patient to tell me how many fingers do you see, and I'm gonna close my eye to my opposite eye from you to have the same visual field, and you're gonna test for the 4 quadrants. So how many?
1, 2, 2, 1.
Okay, and then we do the same for the opposite eye. After this, you're gonna test the movement of the eye muscles, and you can do it with an object again. You're gonna ask the patient to look at that object and just follow it. And then you can do an X. You can do also an H, and you are testing all the muscles. And if the patient follows the object correctly, you can put eye ocular movement of muscle is full, complete. After this, we're gonna use our ophthalmoscope, put it in a diopter of 0, which I already have. Test for the light. Test for the light on your palm of the hand and make sure that it's not too bright for the patient. You're gonna dim the lights, and then you're gonna I'm not gonna dim it right now because the light is far away. And you're gonna evaluate the eye of the patient with your opposite eye. And that way you'll have more free of movement. You're gonna ask the patient to look at your nose, and then 15. I have to stand up. And then around 15 inches away, you're gonna start putting the light on her pupil. And what are you looking here is for the red reflex. In this case, I don't take my glasses out because I have astigmatism. So once you find the red reflex, you're gonna move into the patient, and you can put like your thumb over the eye of over the eye of the patient, and that way when you're getting near to the patient, you won't hit her. And once you are there, you're gonna start looking for the optic nerve, which is yellowish orange structure round. In the medial part, it's a little bit blurry, but it's normal. And then you're gonna follow also like the veins. Veins are dark red, larger in diameter, and the arteries are smaller in diameter and are light red. And you're gonna follow them too. You're gonna go to the lateral side of the retina, look for the fovea, which is a depression on the central part of the retina where vision acuity is the highest, and then the macula is the surrounding area around the fovea. This needs to we need to practice on this because it's hard to see on our first patients, but with practice we can do it. After we finish with the assessment of the eye, we're gonna go to the ears. The ears, again, for the inspection, you're gonna see the shape, the article, the helix. You're gonna do like a tap test. You're just gonna, if you can see me on this side, just gonna pull the pinna out a little bit and make sure that it doesn't hurt for the patient. If she said that it's hurting, it can be sign of inflammation and infection in the ear. After you see this, but you're gonna inspect if there's not any drainage coming out of the ear canal, and then we're gonna use our otoscope and use a cone that is larger so we can inspect the inside of the ear of the ear canal. For adults, you're gonna, if you just wanna stand up and okay. For adults, you're gonna grab the peanut and you're gonna move it back and up. And for kids, you're gonna move it back and down to straight the ear canal and to see, you're gonna look for the rumen, for any foreign bodies, for any swelling, and we're also gonna look for the membrane tympanic membrane, which is usually pearly. That is the usual color, shiny, and if it is like bulging or redness, it can also indicate infection. Also, look if it is not perforated. So this is the way. So you're an adult. I'm gonna pull the peanut up and back and try not to hurt the patient. Like I said, look for cerumen, which you have. And then the pearly, I could see the pearly color of the tympanic membrane. And like also see the body, try to see the body prominence on it. After this, we're gonna test for hearing problems. Any hearing problems on our adults 50 years and older. It's a screening test that we have to do. We can do the whisper test. The whisper test, you're gonna be behind your patient. You're gonna press the tragus and then cover her ear. You're gonna whisper 2 words and tell the patient to repeat it.
Black ball.
Then you're gonna see the opposite. You're gonna do the opposite on the other side.
Okay. Red ball.
And then if you have any problems with that test, then you can use your turning fork to do the Weber and Riemann test. The Weber test, it's look for problems on sound conduction. You're gonna look for any lateralization of sound. Usually patients normally feel it or hear the vibration in the middle of the head. So you're gonna activate your tuning fork with the palm of your hand and put it either on the base of here, like on the head, or you can put it here too, and ask the patient, where do you hear the sound or the vibration? Both ears, one ear. Okay. And then the Riemann test is looking for assessing for air conduction and of sound and bone conduction of sound. Air usually is it's better. So you're gonna activate your tuning fork and put it on her side. And do you hear that?
Yes.
And then that is air conduction, and for bone, you're gonna activate your turning fork and put it on the mastoid process, the bony prominence, which you hear better. After the ears, we're gonna go to the nose. Your nose. Inspect symmetry, any drainage, any the vestibule. Look, and we're gonna look at them with the scope once again, and with your largest cone. We're gonna inspect the inside and look at the mucosa, look at them for any polyps, nodules, exudates, the septum, look for any deviation, perforation. And then also we can evaluate the sinuses. This is the frontal sinuses, and here are the maxillary, and we can like palpate them and ask the patient if it hurts when we do this. And if it does, it's like an indication of sinusitis. Once we finish with our nose, we're gonna go to our mouth. Our mouth, we're gonna look at the lips, like if there's any cracks, any dryness, moist. You're gonna ask the patient to open or to smile. See like the teeth. You're gonna look at the mucosa, at the gums, to see if there are any swelling, bleeding. Also you ask your patient to open her mouth and say okay, and you're gonna see like the soft palate, the hard palate, the uvula, the tonsils, the base of the tongue, and look for any lesions, any abnormalities. After this, we're gonna go to our neck. Also, we're gonna look for any symmetry, symmetry of the neck, of the trachea. And here it's very important that we can assess the lymph nodes. The lymph nodes, there's 10 groups. Let's see if I remember. And you're gonna touch them and look for like the shape and tenderness, swollen of them. Sorry. So there's the lymph nodes that are pre-auricular, right in here. Post-auricular, just above the mastoid process. Occipital, on the base of the skull. Tonsillar, and the angle of the mandible. Submandibular, and like right in the middle of the mandible bone on both sides. Submental, and the tip of the angle, right in the middle. Superficial, cervical superficial, above the sternomastoideo muscle. Posterior cervical, along the trapezoid muscle. Deep cervical chain, and it's like on the base of the sternocleidomastoideo muscle. And supraclavicular lymph nodes, which are above the clavicula in an angle where the sternocleidomastoideo muscle and the clavicula meet, just like in depth in there. After this, we're gonna look for uh, our, like the final part, it's our thyroid. And our thyroid, we're gonna assess it or palpate behind the patient. We're gonna ask the patient to flex the neck, and we are gonna start moving our fingers to the middle of the neck. We're gonna try to find the cricoid process, and if you cannot find it, the trachea. We're gonna try to move them to a side to try to touch and feel and palpate one of the lobules of the thyroid gland, and then the other, and look for any nodules, tenderness, inflammation. We can ask the patient to find it more easily to drink a little bit of water and swallow. And you can see or feel the movement of the thyroid gland. One last thing that I passed and I didn't check on my patient is like the her olfactory, like the smell, and you can do that with species. Like I have here 2 different ones, and I'm just gonna ask her to smell it and try to see and to tell me what it's.
Coffee. Cinnamon.
And that's a way that you can test the smell of the patient. Thank you for give us your time and to watch this video.